Hi, I'm Emily Holmes. I'm your Director of Psychological Health. This year I will be presenting the suicide prevention training for the year 2020. This is your annual training. I know in the past few years we've been meeting in a group session with facilitators face-to-face. So instead of that, we will be sending out this video and this will be your training. And at the end I'll talk about how you'll get credit for it. All right, let's kind of jump right in and let's talk about stress. Stress is a completely normal part of our lives, whether we're emotionally healthy or not. Stress happens to everybody. But it can overwhelm our ability to cope. And so let's take some look at some of the common signs of what happens when we go into distress. Slide. This is not an all-encompassing list, but here are some common signs when you see someone that's probably not coping very well. Mood changes such as depression or anxiety, irritability, agitation or anger, difficulties with sleep, maybe it's too much or too little, or withdrawing from family, friends, or others. During this time when we're actually physical distancing, it might be kind of hard to see, but if you see people that aren't socially connecting to other people, that could be a sign of some distress and to check in on them. You go to the next slide talking about coping skills. How can we balance some of the stress that we deal with on a day-to-day basis? Exercise. Mindfulness exercises, maybe meditation, recognizing and expressing gratitude. That can be writing in a gratitude journal, engaging in creative activities, practicing resilient skills, and again, connecting with friends, family, or nature. Again, this is not a complete list, but this is a good place to start. So what happens if we see someone exhibiting some signs of distress? Go ahead and slide. We use the ACE method, ask, care, and escort. If we see someone that we know, or an airman or a loved one, with some of the signs that I talked about, it's important to ask someone directly, are you thinking about suicide or harming yourself? I'm sorry, go ahead. Yeah. Please ask this directly. Don't avoid it. I know a lot of people have this fear that if they ask that question, it's putting ideas in people's head, and that's not true. Then we're going to show that we care, slide, convey that you care about that person's well-being. Of course you do care, but sometimes we might not always show it. Actually listen to what they're saying, rephrasing, clarifying what they mean, making eye contact. Communicate empathy and listen to what the person is saying and feeling. Slide. And then escort. If there is a person that is verbalizing current thoughts of self-harm, escort them to the most appropriate resource. You can empower them by giving them 2 to 4 appropriate resources, but make sure you are guiding them through that. Slide. And also it's important to remember to go slow. If someone demonstrates signs of distress, consider their access to lethal means. That can include firearms, medications, or other fatal means. Everyone should remember safes, locks, and outside, meaning storing lethal means outside of the home. Slide. Meaningful connection is a valuable tool to prevent suicide. Airmen must be active in reaching out for themselves and others. I will be posting a resource handout on the SharePoint. This will include resources for national and local resources. Will include numbers and what they can help with. I would encourage you to print this out and keep it for any future use. Take it home too as well. There will also be a quiz that I will post on the SharePoint. This will be completed and turned into your unit training manager, and that is how you will get credit for this training. As always, you can reach out to me. If you have questions about, hey, I don't know much about meditation exercises, or I really like to learn more mindfulness, how can I do this? You don't have to be in crisis. It's good to always be ahead of the stress. And also, I mean, if there is a crisis, feel free to call me. The chaplain is available as well. And then there's the National Crisis Suicide Hotline. Again, those will be on the resource list. So thank you and have a good day.